Okay. Hello, it's James McLaughlin here from Advanced Neuro Rehab, and we've got a little important educational session today on something that needed to be done a long time ago, but it's good because it's a very topical issue, and that is concussion. So, concussion is thought to be a temporary disturbance of brain function following trauma to the head, and this can be caused by direct or indirect impact to the head or impact to the neck or body, and most commonly occurs following a motor vehicle accident. We commonly see it after a fall, and of course you can get it in a sports or recreational related injury like you might see in gridiron or cricket, footy or rugby, netball, basketball, and the list goes on and on. So concussions are considered as mild traumatic brain injuries, which can lead to a wide variety of symptoms such as headaches, dizziness, fatigue, changes to balance, vision, memory, and concentration. You can get increased sleep or interrupted sleep is common, as well as changes to mood. It's also common to become more sensitive to many sensations like light and motion sensitivity, which can be either actual motion or just looking at moving objects, or even just looking at busy scenes, and this can make you feel dizzy or even feel a little bit sick. So it's important, first of all, to acknowledge that everybody's experience of concussion can be quite different. So it's now 2020, and we've got a number of recommendations about best practice for people with concussion. And this is important to give people the best opportunity to recover well. It's important to be assessed by a health professional with experience in concussion to help make some important decisions. For example, to confirm the diagnosis of concussion and educate the person and their family about the best early care, and advice about observing and monitoring symptoms over the coming hours and days. You need to make a decision sometimes if any further tests or investigations are needed. For example, a scan of the brain is sometimes needed, and when considering the impact forces involved in a concussion, the neck is likely to be affected, and this needs to be examined further. Sometimes, but not always, we may want an X-ray or an MRI of the neck. You also need to get advice about immediate rest and removal from activities or sports, and then early, gradual return to activity. So the good news is that for most people, symptoms typically should resolve within a period of a few days to a few weeks. However, around 15% of individuals that get concussed can experience prolonged recovery times exceeding 3 months. And this is when it's known as post-concussion syndrome. It's also important that we accept that concussion as a diagnosis is not overly informative, as it can be more than a brain injury. Dr. Julia Treleaven, a physiotherapy researcher from the University of Queensland, has explained this to us very well. She explains that concussion gives some insight into the mechanism of the injury, but as a diagnosis, it does not directly tell clinicians where the patient's deficits are coming from. I'll explain this further. So as I previously said, following a short period of rest, most people will recover and return to normal activities. It's probably important that people do not rest too much and spend prolonged periods out of their normal routines. So while rest and stopping certain activities might be important, rest itself can quickly become detrimental to recovery for some people. If symptoms persist, this can delay a return to normal functioning. So this is where neurological physiotherapy plays an important role. At Advanced Neuro Rehab, we've got experience in assessing some of the important areas that can influence recovery, and we've used this to develop our Advanced Concussion Rehab program. So we start by profiling some of the impairments that may be the drivers of ongoing symptoms for each individual. Some of these drivers may be related to pre-existing conditions, while others may be attributed to injuries at the time of the concussion event. Many of the ongoing symptoms can fluctuate dramatically depending on many factors, including sleep quality, aggravating activities or stimulus, fatigue and stress. Some of the most common drivers we assess include vestibular dysfunction. It's not uncommon for the vestibular apparatus in the inner ear to be affected following concussion, which can lead to ongoing issues of dizziness, imbalance and visual problems. We have the knowledge and skills in assessing and treating problems of the inner ear from our years of experience and training in vestibular rehab. Whiplash. Neck pain and whiplash injury can also lead to problems with pain and movement of the neck, headache, as well as some associated issues that can influence balance, dizziness, vision, and spatial awareness. These issues need to be examined and addressed with specific physiotherapy treatment and exercises. Autonomic dysfunction. Mild brain injury can lead to changes in how your body reacts to stress and exercise. This is because there are changes to the autonomic nervous system function. We have some specific tests that help determine if these brain functions are returning back to normal. These exercise tests can help us to prescribe exercise at an intensity level that can be safely tolerated, which has also been shown to accelerate recovery. Cognitive function. We also can refer to our neuropsychology colleagues for a comprehensive assessment and advice around cognitive functions such as memory, concentration, language, and problem solving. We also have experience in working with people with many ongoing issues that relate to brain injury, including coordination, walking, fatigue, and sensory overload. Mood changes. Anxiety, depression, and fluctuating mood are very common and can have many contributing causes. Many people also suffer from post-traumatic stress from the concussion event, which also needs to be considered when working through your rehab plan. Neurological physiotherapists have experience in working with people with physical, cognitive, and behavioural changes associated with brain injury. So you can see, if concussion is to be managed comprehensively and as early as possible, all the drivers of recovery should be assessed and treated. It is important that we work together to support people through this period of uncertainty and help you return to sport, school, and life. In doing so, we are happy to work as a team with your family, mum or dad, sporting coaches, work employers, and any other health providers in working out the best plan for your recovery. If you want to know more about concussion and the role of neurological physiotherapy or our advanced concussion rehab program, please contact us at Advanced Neuro Rehab. Thanks for listening.